Okay, now, again, we're gonna do this shit again. Anemia, you know you gotta have a patient, it might be hypochromic. Uh-oh, what's all doing? Okay, baby.
Try to do it fast.
I know, right? Like, what you wanna write is hypochromic. Write hypochromic and write microcytic at the top. Oh, hypochromic is up there. It's in the circle already. So put iron deficiency anemia. Hypochromic is actually in there already. You see where it says iron deficiency anemia? All you need is microcytic. Microcytic. So you got what you need. All right, now, you want to know the select all. It's going to be short of breath with exercise, tachycardia, pallor, spoon nails, exhaustion or fatigue, mouth sores, I said tachycardia, right? Yeah. Dizzy or syncope. Polycythemia. I'll write it on the board. Great. Glossitis. Write them on the board. Polycythemia and glossitis. Sometimes you see stomatitis for mouth sores. Stomatitis, yeah. Okay. God bless you. Pica. Pica means craving non-food items. Now you're supposed to keep it up here because it's a whole other anemia, but it's okay. Keep it up at the top. Let's see. Jaundice if it's severe. Jaundice if it's severe. Splenomegaly if it's severe. Splenomegaly if it's severe. Tinnitus or tinnitus. Tinnitus or tinnitus. Ringing in the ears. Vertigo. If you turn the page, you might see iron supplementation, I think, or I hope. Yes, thank you, Jesus. Iron supplementation, you got a few things to do for this one. If it's IM, it's a Z-track. Give with high vitamin C foods. So give with high vitamin C foods. Treat the patient up to 3 months after it corrects. So you got the patient on iron. You want to give it to them 3 more months, even after it corrects. Remember to give the patient instructions to take it on an empty stomach, because of what we talked about earlier, with the stomach's role in absorption. Do not give it with dairy. Do not give it with dairy. Do not take it with coffee or tea. Don't take it with antacids. Don't take it with a prenatal vitamin or a regular vitamin. multivitamin. Examples of good fruit, good drinks to take it with, tomato juice. Don't just think orange juice, think tomato juice for your vitamin C. The patient will need high iron and high fiber foods. Let me give you all the high iron foods. Any green leafy vegetable, like spinach, kale, collards. Any meat, but especially red meat and organ meat, and egg yolks. Legumes, tofu, seafood, dried fruit. It is high in salt, so watch it. Farina. What the hell is that? That's cream of wheat. Nasty shit. Yep, that's on Farina's on Little Rascals. Use a straw with liquid iron. Use a straw with liquid iron. This can cause constipation. Don't forget, don't take away antacids. I think that was on somebody's test.
Can that stain their teeth?
That's why you take it with a straw. Yeah, it can stain your teeth. Okay, y'all, that's it, shit. The next one, G6PD is right next to that. Go to the front page. I mean, not the front page, the circles. The little circles you just got up off of. So turn one page backwards. Yep, circles. Okay, this is what you're going to put on your circles. Down at the bottom, you have a circle that says increased RBC destruction, yes? This is called hemolysis. Hemolysis means RBC destruction. That's what the problem is with G6PD. It is an X-linked disorder, which means usually boys, but I know a lot of girls that actually have it, but usually it's boys. The patient needs to avoid fava beans and mothballs. This is triggered by an infection or fever. We treat it with a blood transfusion. Watch NSAIDs. No NSAIDs, no sulfa drugs. No beans at all, I always say. No beans at all. Okay, that's that. Pernicious anemia, which is on the circle on the right. This is a B12 deficiency, right, everybody? It's the circle on the right. Hope you're not writing anything down at the bottom. Okay, then. B12 deficiency is lack of an intrinsic factor. Patients at high risk for stomach cancer. I'm going to say that again because it's important. B12 deficiency is pernicious anemia. The patient lacks the intrinsic factor. Vitamin B12 is in all meat. Vitamin B12 is in all meat, cheese, nuts, eggs, and milk. These symptoms include a paresthesia. Patient has a paresthesia, can have dementia, and peripheral neuropathy. Aplastic anemia is an anemia that I want you to make sure you know that A before a word means without So you need to put without white, red, or platelets. Without white blood cells, WBCs, without red blood cells, RBCs, without platelets. No white, no red, no nothing, without everything. A before word means without. Now why? Well, the word tells you why. Plastic is a chemical. So because of chemicals, this person does not have these cells. This is called, please quote me, myelosuppression. Myelosuppression. In other words, bone marrow suppression. Myelosuppression. I wrote it on the board, the mnemonic that I want you to put for that one is ANT. Anemia, neutropenia, thrombocytopenia is what they're going to have. So they cannot get live vaccines like MMR. No MMR. Okay? Turn the page after your iron. So flip and turn. Flip and turn. Yep. Sickle cell, you don't care. Flip it, turn again. Turn another page. What's that? Hemophilia, you don't care. Turn again. That one you care. Leukemia. For leukemia, look what it says. It says ANT. Everybody see that? Okay, ANT. Anemia is already written for you. Neutropenia is already written for you. Thrombocytopenia. Now this is what I need you to do. For the A, I need you to write what I wrote. But you're going to write erythropoietin, because you do know that already, right? That epoetin is erythropoietin. Erythropoietin. Would that be a yes or no? I don't know. I'm sleepy. What would that be? Okay, erythropoietin. Who produces erythropoietin? Kidneys, in response to hypoxia. So when a patient has a problem with this anemia, then we may give them epoetin, which is Procrit. I want you to write Procrit as well. So 3 different ways to say this, actually 4. Epoetin, erythropoietin, epogen, and Procrit. When you think of Procrit, think prohematocrit. When you think of epogen, I taught you that the words ending in gen generate whatever's at the beginning. So epoetin, epogen generates erythropoietin. Now again, the kidneys make this. It stimulates the bone marrow to produce red blood cells. You have a thing that says decreased hemoglobin. I would urge you to put decreased hematocrit as well. We call this a H&H. You have to know your labs. So it would be an H&H less than 12 and 36. Please write what I tell you. H&H less than 12 and 36. Up there by anemia. Keep your life simple. Keep everything together. Anemia is on the right-hand side of the page. It already has a hemoglobin written for you. You just need to add hematocrit and put less than 12 and 36. Okay. The next one is neutropenia. Here, you're going to put white blood count less than what? 5,000. Your test definitely has this on there. Less than 5,000. What medicine is written by it? Look at it. It ends in gen. It generates the root word, which is neutrophils. Neupogen. You know why you give a shit that ends in gen? Because the next medication looks just like it, and it's not the same. Numega. Numega is also on this exam. It's for your thrombocytopenia, but there's also another way to get your platelets up, and that would be steroids. You can use steroids to get your platelets up. Okay? Now, platelets less than what? 150,000, you jamming. Okay, now, just for the record, I got to give you some information here. One is for Gleevec. If you can, please write down Gleevec and make sure you know that Gleevec is to decrease, I think it was the Philly chromosome.
Yeah, in chronic mode.
Yep, let's see, I wrote it down, I gotta find it, I don't wanna tell you wrong. Where'd I write it? Here it is, okay. Gleevec is for leukemia, specifically CML. It inhibits the Philadelphia chromosome. No grapefruits. So no grapefruits. There was something else on this. It may say, okay, quote me, stops protein so the cells can't grow. Take it with food, and it can cause fluid retention. Take with food and fluids. It can cause food retention and it can cause vomiting. Gleevec, or CML, inhibits the Philadelphia chromosome and again decreases the protein that makes this cancer grow. Protein kinase inhibitor. Take it with food and water. Okay. Just remember that Hodgkin's and non-Hodgkin's, you can write it on this page, non-Hodgkin's is not good. So that's what we say for that. Non-Hodgkin's is not good. It's related to Epstein-Barr. Hodgkin's, which is the one you hope that the patient gets, is going to be Reed-Sternberg cells. Reed-Sternberg cells. Okay, let's keep it moving. You have a handout that's next. What does it say? Oh, perfect. On this page, put polycythemia, because as a nurse with a patient that has polycythemia, you're going to push fluids. So put your polycythemia. Think of the word. Poly means what? Many. Cyto means cells, emia, blood cells. This patient has a whole lot of blood cells, and there's increased white, red, and platelets, all three. So that makes the blood thick. What color is blood?
Red.
Your patient's flushed. What's the temperature of blood?
Warm.
Your patient's hot. They're warm. The blood is thick. It's got an increased osmolarity. Most important thing the patient can do is push fluids. Polycythemia vera is cancer. They usually die within 2 years. This patient is going to, when you say flush, your chest may say ruddy. They may say plethoric. Patients with all those blood cells itch. So they have itching. They have fluid volume overload in terms of a high blood pressure and JVD. Hepatosplenomegaly. Treatment is with hydroxyurea. Patient needs TED hose and to exercise. They have a high hematocrit and hemoglobin. High potassium and high uric acid. Put a star by those three. High HH, high uric acid, high potassium.